Good morning, everyone. Today, I want to talk about one of the most important stages in pregnancy, the first 12 weeks. These early weeks are often called the first trimester. And although a woman may not yet look pregnant, incredible changes are happening inside her body every single day. The first 12 weeks are the foundation of the entire pregnancy. During this short period, a tiny fertilized egg develops into a growing baby with a beating heart, forming organs and recognizable features. By the end of the first trimester, the basic structure of the brain, spinal cord, heart, lungs, liver, kidneys, arms, fingers, and toes has already begun to develop. In many ways, these weeks are the blueprint for the months that follow. This is why early pregnancy care matters so much. Many women discover they are pregnant several weeks after conception, but the baby has already started developing rapidly. Good nutrition, proper rest, and healthy lifestyle choices during these weeks can make a meaningful difference for both mother and baby. One nutrient that deserves special attention is folate or folic acid. Folate helps support the healthy development of the baby's brain and spinal cord. Healthcare providers often recommend a prenatal vitamin that contains folic acid along with other important nutrients such as iron, iodine, vitamin D, and choline. Many women experience symptoms during the first trimester. Fatigue is one of the most common. The body is working hard to support the growing pregnancy, and hormone levels are changing quickly. Nausea, often called morning sickness, may occur at any time of the day. Food cravings, food aversions, breast tenderness, and mood changes are also common experiences. These symptoms can sometimes be frustrating, but they are often signs that the body is adapting to pregnancy. Simple strategies such as eating small, frequent meals, staying hydrated, getting enough sleep, and avoiding long periods without food can help many women feel better. The first 12 weeks are also a time for important medical checkups. Early prenatal visits allow healthcare providers to confirm the pregnancy, estimate the due date, review medications, and discuss any health conditions that may need monitoring. Blood tests and an early ultrasound may be recommended to help ensure everything is progressing normally. Equally important is emotional well-being. Pregnancy brings excitement, but it can also bring uncertainty. It is completely normal to feel a mixture of joy, worry, anticipation, and even fear. No woman should feel that she has to go through these emotions alone. Support from family, friends, and healthcare professionals can make a tremendous difference. Healthy lifestyle choices during these weeks are essential. Avoiding smoking, alcohol, and recreational drugs is one of the best ways to protect the developing baby. Regular gentle activity, when approved by a healthcare provider, can support energy levels and overall health. Drinking enough water and choosing nutritious foods help provide the building blocks the baby needs to grow. Perhaps the most amazing fact is that by the end of the first 12 weeks, a baby is already moving, swallowing, and continuing to develop at an astonishing pace. Even though the baby is still very small, the groundwork for a healthy future has been laid. So when we talk about the first 12 weeks of pregnancy, we are really talking about the beginning of a remarkable journey. These weeks may seem short, but they are filled with extraordinary growth, important decisions, and countless tiny milestones that mark the start of a new life. Thank you. Proper nutrition during the first 12 weeks of pregnancy is one of the greatest gifts an expectant mother can give her growing baby. Although the baby is still very small, its nutritional needs are enormous because millions of new cells are forming every day. During this stage, the brain, spinal cord, heart, and every major organ begin to develop, making a balanced and nutrient-rich diet especially important rather than eating for two. The focus should be on eating twice as wisely by choosing foods that provide vitamins, minerals, healthy fats, protein, and fiber. Every healthy meal contributes to creating an environment where the baby can grow and develop as intended. One of the most essential nutrients during early pregnancy is folate, also known as vitamin B9. Folate plays a vital role in the formation of the baby's neural tube, which later develops into the brain and spinal cord. Adequate folate intake before conception and throughout the first trimester has been shown to reduce the risk of certain neural tube defects. Because these structures develop very early in pregnancy, often before a woman even realizes she is pregnant, healthcare providers commonly recommend taking a prenatal vitamin containing folic acid in addition to eating foods naturally rich in folate. Leafy green vegetables, beans, lentils, avocados, asparagus, and fortified whole grain cereals are excellent dietary sources. Protein is another critical nutrient because it provides the building blocks needed to create new tissues for both the mother and the developing baby. Every organ, muscle, and cell depends on protein for growth. Good sources include lean poultry, fish that are low in mercury, eggs, dairy products, beans, lentils, tofu, nuts, and seeds. Including a source of protein with each meal can also help maintain stable energy levels and support healthy blood sugar balance throughout the day. Iron becomes increasingly important during pregnancy because the mother's blood volume begins to expand to supply oxygen and nutrients to the growing baby. Without enough iron, the risk of iron deficiency anemia increases, which may contribute to fatigue and other complications. Lean red meat, poultry, beans, spinach, fortified cereals, and lentils are valuable sources of iron. Pairing iron-rich foods with foods high in vitamin C, such as citrus fruits, strawberries, tomatoes, or bell peppers can improve iron absorption and help the body use this nutrient more efficiently. Calcium and vitamin D work together to support the baby's developing bones and teeth while helping maintain the mother's own bone health. Dairy products such as milk, yogurt, and cheese are excellent calcium sources. For women who do not consume dairy, fortified plant-based beverages, calcium, set tofu, almonds, and certain leafy greens can also contribute to meeting calcium needs. Vitamin D is obtained from sunlight exposure, fortified foods and supplements when recommended by a healthcare provider. Maintaining adequate vitamin D levels supports calcium absorption and contributes to healthy immune function. Choline is another nutrient receiving increased attention because of its role in brain development and nervous system function. Eggs are among the richest natural sources of choline, while meat, fish, poultry, soybeans, and dairy products also contribute meaningful amounts. Although many prenatal vitamins contain some choline, dietary intake remains an important source, making it worthwhile to include choline-rich foods as part of a balanced eating pattern. Healthy fats should not be overlooked during the first trimester. Omega-3 fatty acids, particularly DHA, contribute to the normal development of the baby's brain and eyes. Fatty fish that are low in mercury, such as salmon, sardines, and trout, provide DHA along with high-quality protein. For women who do not eat fish, algae-based DHA supplements may be an option after discussing them with a healthcare provider. Nuts, seeds, flaxseed, and walnuts also provide beneficial fats that support overall maternal health. Hydration is equally important because water supports increased blood volume, nutrient transport, digestion, temperature regulation, and the production of amniotic fluid. Dehydration can contribute to headaches, constipation, and fatigue, making regular fluid intake an important daily habit. Water should be the primary beverage, while sugary drinks should be limited. Women experiencing morning sickness may find it easier to sip small amounts of water throughout the day or include water. Rich foods such as watermelon, cucumbers, and soups. Morning sickness can make healthy eating more challenging during the first trimester. Nausea and food aversions often reduce appetite, but eating small, the frequent meals instead of large ones may help reduce discomfort. Bland foods such as crackers, toast, rice, bananas, and applesauce are often easier to tolerate. Ginger has been shown to help relieve mild pregnancy. Related nausea for some women, while keeping simple snacks nearby may prevent the stomach from becoming completely empty, which can sometimes worsen nausea. If vomiting becomes severe or prevents adequate food and fluid intake, medical evaluation is important because treatment may be needed. Food safety also deserves careful attention during pregnancy. Certain foods carry a higher risk of foodborne illness, which can be more serious during pregnancy. Undercooked meat, raw seafood, raw eggs, unpasteurized dairy products, and foods made with unpasteurized milk should generally be avoided. Fruits and vegetables should be washed thoroughly before eating, and leftovers should be stored and reheated properly. Limiting fish known to contain high levels of mercury is another important precaution, because excessive mercury exposure can affect the developing nervous system. While nutrition plays a powerful role in supporting a healthy pregnancy, it is only one part of comprehensive prenatal care. Every pregnancy is unique, and nutritional needs can vary depending on a woman's health, medical history, dietary preferences, and any pregnancy-related conditions. Working closely with a qualified healthcare provider helps ensure that both mother and baby receive individualized guidance, with appropriate prenatal supplements and ongoing monitoring throughout these important first 12 weeks. The healthy lifestyle habits during the first 12 weeks of pregnancy can have a lasting impact on both the mother and her developing baby. While nutrition provides the essential building blocks for growth, everyday choices such as getting enough sleep, staying physically active, managing stress, avoiding harmful substances, and attending regular prenatal appointments all contribute to creating the healthiest possible environment for a new life. The first trimester is a period of extraordinary change, and adopting healthy habits early can help support a smoother pregnancy while reducing certain risks for both mother and baby. One of the most important lifestyle habits during early pregnancy is getting enough rest. Many women are surprised by how exhausted they feel during the first trimester. This fatigue is not simply a result of carrying a baby, it reflects the tremendous work the body is doing behind the scenes. Hormone levels, particularly progesterone, rise significantly, helping support the pregnancy but also contributing to increased sleepiness. At the same time, the body is producing more blood, building the placenta, and supplying nutrients to the rapidly developing embryo. These processes require a great deal of energy. Listening to the body's signals and allowing extra time for sleep or short daytime naps can support overall well-being and help manage fatigue. The physical activity is another valuable part of a healthy pregnancy. Unless a healthcare provider advises otherwise because of specific medical conditions or pregnancy complications, moderate exercise is generally considered safe and beneficial. Activities such as walking, swimming, prenatal yoga, and gentle stretching can improve circulation, reduce stress, support healthy weight gain, and enhance overall fitness. Regular movement may also help relieve constipation, improve mood, reduce back discomfort, and prepare the body for labor. The goal is not to achieve athletic performance, but to maintain an active lifestyle that supports both physical and emotional health. Women who were already exercising before pregnancy can often continue with appropriate modifications after consulting their healthcare provider. Stress management is equally important during the first trimester. The pregnancy is an exciting time, but it often comes with many questions and uncertainties. Concerns about the baby's health, upcoming lifestyle changes, finances, work responsibilities, And the childbirth experience can all contribute to emotional stress. While occasional stress is a normal part of life, finding healthy ways to cope can improve overall well-being. Deep breathing exercises, but mindfulness meditation, gentle yoga, reading, listening to calming music, spending time in nature, or talking openly with supportive family members and friends can all be helpful strategies. Some women also benefit from joining prenatal support groups where they can share experiences and learn from others going through similar journeys. Avoiding harmful substances is one of the most important ways to protect the developing baby during these early weeks. Alcohol should be avoided throughout pregnancy because no safe amount has been established, and alcohol exposure can interfere with normal fetal development. Smoking also poses significant risks, including reduced oxygen delivery to baby, lower birth weight, and an increased risk of pregnancy complications. Exposure to secondhand smoke should be minimized whenever possible. Recreational drugs should also be avoided because many can affect the baby's growth and brain development. If a woman is taking prescription medications, she should never stop them abruptly without medical advice. But she should review every medication and supplement with her healthcare provider to ensure it is appropriate during pregnancy. Caffeine is another topic that often raises questions. The many healthcare providers recommend limiting caffeine intake during pregnancy rather than eliminating it completely. Because caffeine can cross the placenta, moderation is generally advised. Coffee, tea, chocolate, energy drinks, and certain soft drinks all contribute to daily caffeine intake. Reading labels and discussing individual recommendations with a healthcare provider can help women make informed decisions based on their specific health needs. Environmental safety is another aspect of a healthy lifestyle that is sometimes overlooked. Pregnant women should try to reduce unnecessary exposure to harmful chemicals whenever possible. This includes avoiding cigarette smoke, limiting exposure to strong cleaning products or paint fumes in poorly ventilated areas, and then following workplace safety recommendations if occupational exposures are a concern. Good hand hygiene, safe food handling, and staying up to date with recommended vaccinations after discussing them with a healthcare provider also help reduce the risk of infections that could affect pregnancy. Maintaining regular prenatal care is one of the healthiest habits an expectant mother can develop. Early prenatal visit to monitor the baby's development, identify any potential concerns, but discuss symptoms and receive personalized advice about nutrition, exercise, medications, and overall health. These appointments also allow healthcare providers to screen for conditions such as high blood pressure, diabetes, anemia, or infections that may require treatment or closer monitoring. In open communication with healthcare professionals helps ensure that questions are answered promptly and that concerns are addressed before they become more serious. Emotional well-being deserves just as much attention as physical health. Hormonal changes during the first trimester can influence mood, making it normal for women to experience excitement, happiness, anxiety, or even periods of sadness. Having a strong support system can make a significant difference. Partners, family members, close friends, and healthcare professionals all play important roles in providing encouragement and reassurance. Women should feel comfortable discussing emotional challenges with their healthcare provider, especially if feelings of sadness, anxiety, or hopelessness become persistent or interfere with daily life, as mental health is an essential part of a healthy pregnancy. Ultimately, the first 12 weeks offer an opportunity to establish habits that can benefit both mother and baby throughout the remainder of pregnancy, prioritizing adequate rest, engaging in appropriate physical activity. The managing stress, avoiding harmful substances, attending regular prenatal appointments, and caring for emotional health all work together to support the remarkable process of new life developing during these critical early weeks. The first 12 weeks of pregnancy often bring a wide range of physical and emotional changes that can surprise even women who have been pregnant before. Every pregnancy is unique, and while some women experience only mild discomfort, others may find the first trimester particularly challenging. Understanding these common symptoms and learning practical ways to manage them can help expectant mothers feel more confident and better prepared during this important stage. Most of these changes are caused by rapidly increasing pregnancy hormones and the body's remarkable efforts to support the growing baby. One of the earliest and most common symptoms is fatigue. Many women notice that they feel unusually tired even after a full night's sleep. This overwhelming exhaustion is completely normal because the body is working around the clock to build the placenta, increase blood supply, produce essential hormones, and nourish the developing baby. Progesterone levels rise significantly during early pregnancy, which can also contribute to feelings of sleepiness. Rather than trying to push through the fatigue, it is important to listen to the body's signals, getting enough sleep each night, taking short naps when possible, staying hydrated, eating balanced meals, and accepting help with daily responsibilities can make a noticeable difference. Morning sickness is another well-known symptom, although it can occur at any time of the day or night. Nausea usually begins around the 6th week of pregnancy and often improves after the first trimester, although some women experience it for longer. The exact cause is not fully understood, but pregnancy hormones are believed to play a significant role. Fortunately, there are several strategies that may help reduce nausea. Eating small, frequent meals instead of large ones can prevent the stomach from becoming empty, which may worsen symptoms. Keeping plain crackers by the bedside and eating a few before getting out of bed may help some women. The ginger tea, ginger candies, or fresh ginger may provide relief for mild nausea, while staying hydrated by sipping water throughout the day is also important. If vomiting becomes severe or prevents adequate eating and drinking, medical attention should be sought because treatment may be necessary. Food cravings and food aversions are also common during the first trimester. A woman may suddenly crave foods she rarely enjoyed before pregnancy while finding the smell or taste of favorite foods completely unappealing. These changes are thought to be influenced by hormonal shifts and heightened sensitivity to taste and smell. While occasional cravings can usually be enjoyed in moderation, maintaining a balanced diet remains the priority. If healthy foods become difficult to tolerate because of nausea or aversions, the eating whatever nutritious foods can be comfortably managed is often more important than striving for perfection. As symptoms improve later in pregnancy, it usually becomes easier to expand food choices again. Breast tenderness is another early sign of pregnancy. Hormonal changes increase blood flow and prepare the breasts for future milk production, causing swelling, soreness, and increased sensitivity. Wearing a well-fitting, supportive bra can help reduce discomfort, especially during physical activity or while sleeping. Choosing soft fabrics and avoiding unnecessary pressure on the breast may also improve comfort as the body adjusts to these changes. Frequent urination is another symptom many women notice early in pregnancy. Hormonal changes and increased blood flow to the kidneys cause the body to produce more urine, while the growing uterus can place additional pressure on the bladder. Although it may be tempting to reduce fluid intake, staying well hydrated remains essential for both maternal and fetal health. Drinking adequate water throughout the day helps support increased blood volume, digestion, and overall pregnancy health. Reducing caffeinated beverages may also decrease bladder irritation and help improve comfort. Many women experience bloating and constipation during the first trimester. Pregnancy hormones slow digestion, allowing the body more time to absorb nutrients for the developing baby, but this slower digestion can also lead to uncomfortable digestive symptoms. Eating plenty of fiber, rich foods such as fruits, vegetables, whole grains, beans, and legumes, along with drinking enough water, can help support healthy bowel function. Gentle physical activity, including regular walking, may also stimulate digestion and reduce constipation. If symptoms become severe, a healthcare provider can recommend safe treatment options during pregnancy. Mood changes are another common experience during the first 12 weeks. Rapid hormonal fluctuations combined with the excitement and uncertainty of pregnancy can cause emotions to shift quickly. A woman may feel joyful one moment and anxious or tearful the next. These emotional changes are completely normal and do not indicate weakness. Open communication with a partner, trusted family members, close friends, or healthcare providers can provide reassurance and emotional support. Taking time for relaxation, enjoying hobbies, practicing mindfulness, and maintaining healthy sleep habits can also help improve emotional well-being during this period. Some women may experience mild cramping or light spotting during early pregnancy. In many cases, these symptoms are harmless and may occur as the embryo implants into the uterus. However, because cramping and bleeding can sometimes indicate a more serious problem, any persistent heavy or painful bleeding should be evaluated promptly by a healthcare provider. Severe abdominal pain, heavy bleeding, fever, persistent dizziness, or severe vomiting are all symptoms that require immediate medical attention rather than self-treatment at home. Perhaps the most important message for expectant mothers is that every pregnancy is different. Comparing symptoms with those of friends, family members, or previous pregnancies may only increase unnecessary worry. Some women experience many symptoms, while others have very few and still go on to have completely healthy pregnancies. Paying attention to the body's signals, attending regular prenatal appointments, maintaining healthy daily habits, and seeking medical advice whenever concerns arise can help ensure that both mother and baby receive the care they need throughout these remarkable first 12 weeks. The first 12 weeks of pregnancy are not only a time of incredible growth for the developing baby, but also a crucial period for establishing prenatal care. The many women wonder when they should schedule their first doctor's appointment after discovering they are pregnant. The answer is simple: as early as possible. Early prenatal care allows healthcare providers to monitor the health of both mother and baby, identify potential risks, answer important questions, and provide guidance that can help support a healthy pregnancy from the very beginning. These early visits are the foundation of prenatal care and play an essential role throughout the months ahead. The first prenatal appointment is often one of the longest because it involves gathering detailed information about the mother's overall health. The healthcare provider will ask about previous pregnancies, existing medical conditions, surgeries, allergies, family medical history, medications, lifestyle habits, and any symptoms the mother is currently experiencing. This information helps identify factors that may require additional monitoring during pregnancy. Women are encouraged to be open and honest during these discussions because every detail helps healthcare providers develop the safest and most effective care plan. And one of the first goals during early prenatal care is confirming the pregnancy and estimating the baby's due date. Healthcare providers usually calculate the expected due date based on the first day of the woman's last menstrual period. However, because menstrual cycles vary, an early ultrasound is often used to provide a more accurate estimate of the baby's age and expected delivery date. Establishing the correct due date is important because it guides future prenatal testing. and monitors fetal growth and helps healthcare providers determine whether the pregnancy is progressing appropriately. Blood tests are another essential part of the first prenatal evaluation. These tests provide valuable information about the mother's health and can identify conditions that may need treatment or closer monitoring. Blood work commonly includes determining blood type and WAR factor, checking for anemia by measuring red blood cell levels, and screening for infections such as hepatitis B, hepatitis C, HIV, and syphilis. Immunity to certain infections, such as rubella, may also be assessed because contracting these illnesses during pregnancy can pose risk to the developing baby. Identifying these conditions early allows healthcare providers to recommend appropriate treatment or preventive measures. A urine test is also commonly performed during early pregnancy. This simple test can detect signs of urinary tract infections, protein levels, glucose, and kidney function. Some urinary tract infections may not cause noticeable symptoms but can become more serious during pregnancy if left untreated. Routine urine testing helps identify these problems before complications develop. Allowing timely treatment that supports both maternal and fetal health, ultrasound examinations are among the most exciting milestones during the first trimester. Depending on when the pregnancy is confirmed, an ultrasound may be performed to verify that the pregnancy is developing inside the uterus, confirm the baby's heartbeat, estimate gestational age, and determine whether more than one baby is present. For many parents, seeing the baby's heartbeat for the first time creates an emotional connection that makes the pregnancy feel even more real. At the same time, the ultrasound provides valuable medical information that helps ensure the pregnancy is progressing normally. During the first trimester, healthcare providers may also discuss optional genetic screening tests. These screening tests estimate the likelihood of certain chromosomal conditions, such as Down syndrome, rather than providing a definite diagnosis. Depending on the mother's age, family history, medical history, and personal preferences, options may include blood tests, ultrasound measurements, or non-invasive prenatal testing that analyzes small amounts of fetal DNA circulating in the mother's blood. Healthcare providers explain the purpose, benefits, and limitations of these tests so parents can make informed decisions based on their own values and circumstances. Prenatal appointments are also an opportunity to review medications and supplements. Some prescription medications, over-the-counter drugs, herbal products, or dietary supplements may not be recommended during pregnancy. Rather than stopping medications independently, women should consult their healthcare provider who can determine whether adjustments are necessary or recommend safer alternatives when appropriate. Prenatal vitamins containing folic acid, iron, iodine, and other essential nutrients are often discussed to help ensure adequate nutritional support throughout pregnancy. Vaccination status may also be reviewed during early prenatal care. Certain vaccines are recommended before or during pregnancy to help protect both mother and baby from preventable infections. Healthcare providers can explain which immunizations are appropriate based on current medical guidelines and individual health circumstances. These discussions are an important part of preventive healthcare during pregnancy. Perhaps one of the most valuable aspects of the first prenatal visits is the opportunity to ask questions. Pregnancy often brings excitement along with uncertainty, especially for first-time parents. Women may have questions about nutrition, exercise, travel, work, medication, sexual activity, weight gain, morning sickness, or symptoms they are experiencing. No question is too small or unimportant. Open communication with healthcare providers helps reduce anxiety and empowers parents with reliable, evidence-based information instead of relying on myths or misinformation. Healthcare providers also explain warning signs that require immediate medical attention. Heavy vaginal bleeding, severe abdominal pain, persistent fever, leakage of fluid, severe vomiting leading to dehydration, fainting, or other concerning symptoms should never be ignored. The understanding when to seek prompt medical care helps protect both mother and baby during these important early weeks. The first 12 weeks of pregnancy represent the beginning of a remarkable journey, and regular prenatal care provides the guidance needed every step of the way. Through physical examinations, blood tests, urine testing, ultrasound evaluations, genetic screening discussions, medication reviews, and ongoing education, healthcare providers work closely with expectant mothers to promote healthy pregnancies and identify concerns before they become serious. These early appointments are much more than routine checkups. They are an investment in the lifelong health and well-being of both mother and child.